Hello and welcome. Hello. This session will be recorded, just for you to know, and will be live streamed to YouTube. Welcome to the European Public Health Week 2021. 2021, yeah, that's right. Sorry about that. We are today looking at today's theme, which is new challenges of mental health. And we are joined by an amazing team of panelists we will introduce into you shortly. And I wanted to, before we start, I wanted to extend my thanks to UFA Next, who is collaborating with us on this event today. Also UFA, especially Deborah Miranda, who helped us with the technical setup, and also Viola Grave, who will be supporting the technical side of things. And you can also send her in the chat, send her a text if you have any technical issues. There's some information for you if you want to follow us on Twitter or follow the discussion on Twitter. You can use the hashtag future of public mental health. It's also written in the chat, and you can also use the hashtag EUPHW, and you can also tag UFA Next and UFA Acts. I would like to start with some opening remarks. We are now 1 year and a half roughly in this pandemic, and we have seen, whilst COVID re-emphasized public mental health or urgent public mental health issues, we have also seen that it re-emphasized difficulties and also health system flaws. In the light of current and future health challenges, namely the risk for widening health inequities, and also climate change or the climate emergency, we as next generation researchers could be drivers of change to make public health more comprehensive by further foregrounding public mental health research. Today, we will discuss with public mental health researchers, lived experience experts, and practitioners how we can shape the future of the public mental health research agenda, and to make it more holistic, inclusive, and future-oriented. As now is a critical time because we are still, or we will be, in the recovery phase after the pandemic, but also we need to start thinking about the climate emergency. So there's a critical time, but there's also a chance for change, which we can look at today. I would like now to start introducing our panelists, and I will give the word to Arjan.
Yes, hello everyone. My name is Arjan, and I'll be co-moderating this session with Frida. Now it would be my pleasure to introduce the panelists, but we'll go one by one. First, introduce each panelist, ask them for some opening remarks, followed by some questions that we'll pose to them before moving on to the next panelist. So to get started, let me then introduce our first panelist of today, who is Matej Vinko. He's a public health specialist and also the head of the task force for psychosocial support during COVID-19, and also the head of the mental health expert group at the National Institute of Public Health of Slovenia. And I would like to give the floor to Matej now to make some opening remarks.
Thanks, Ariane. It's a delight and honor to be part of this panel. I'll start from the public health practitioner side, as that was the major experience of the past year for me, leading the task force for psychosocial support, as you've mentioned. I was thinking about the remark or the statement today, and I ended up with three conclusions that yeah, I've kind of extracted from the past year's experience. And the first one is that when we're talking about the COVID response in terms of mental health, at least in my experience in Slovenia, there's a huge discrepancy between the awareness and readiness of various experts in mental health to act and to address pressing issues and needs, and on the other side, the capacity of the system to either implement it or upscale it to offer those actions, interventions to whole of the population. So that's the first one. And then connected to this one, the importance of existing infrastructure. What I've learned is that once you have some basic infrastructure, some basic processes already established that are maybe not even primarily meant to support mental health or offer any psychosocial support, but as long as they are equitably distributed throughout the population, as long as they reach all the population groups that you need, you know, they are worth a million. And without that, yeah, it's a really uphill struggle. And the last conclusion is that working during the COVID is extremely stressful. That's my personal experience. Yeah, and I quite struggled with it, but yeah, I think also from the public health practitioner side, I'd say that. Yeah, that would be all from me for the beginning.
Yeah, that's very interesting, the things you mentioned there. I was just wondering, can you expand a little bit more on, because you already alluded to sort of system flaws in general, but can you highlight a bit more some specifics of those various systems flaws that you may have identified during the pandemic, and how things actually got further exaggerated maybe because of the pandemic?
Yeah, well, maybe so during the pandemic, you know, various sectors from health, social protection, education adapted to the needs of the pandemic. You know, there were various measures implemented, and they started, or they collaborated, they crossed those borders, fences, relatively successfully when it came to the you know, infection containment measures and so on. But when it came to mental health focused or psychosocial support focused actions, interventions, you know, we really struggled because at the beginning, I mean, everyone acknowledges the importance of mental health, but then again, they all have their own way of addressing it, of working on those topics within their sectors, and coming with some interventions that would address, on one hand, the specific issues or needs that emerged during COVID, while also you know, be widely distributed, so accessible to all of the population. For that, we needed to enter the system as it is. and that was it was almost a mission impossible. Now, why is that? Well, I would say that a big factor is that we don't all speak the same language when it comes to mental health. It's the fact that we all acknowledge it. We all know it's super important. It's but we all have our own ways of addressing it, and we're not quite comfortable, opening up our ways to outsiders, or maybe that's the best way to put it. Even though everyone is in a way an expert working in their own field, sometimes even experts on mental health, but working in social protection sector, the other one working in healthcare sector. And yes, those interconnections aren't really developed in a way that they could adjust quick enough to kind of offer the needed support, or whatever is needed.
Right. So if I understand correctly, for other sort of crisis response regarding the pandemic, there was sort of more collaboration and interdisciplinary sort of collaboration. But for mental health, it rather remained in sort of silos.
Yeah,
am I hearing that right?
Yeah, it was a topic that you really had to go an extra mile to penetrate into the whole discourse of addressing the pandemic and what are the needs, and then we tried to open various doors, humanitarian response, or different ways of introducing some quite very basic interventions, such as I don't know, psychological first aid education for the field workers and so on. And when we succeeded because we kind of we only focused on one sector. We kind of approach it in a sector specific way, which is frustrating for someone working in public health. But in the end, that was what was successful. So.
Right. Now, with that experience that you have in Slovenia, can you think of any sort of solutions or a way forward that we can break away from that, or can work towards a more integrated approach for mental health? Well,
yeah,
more the system in general, or maybe even in the context of a crisis moving forward.
Yeah, that's a tough question. I haven't seen any really great example of kind of a taking mental health needs in serious enough, or to for them to be taken on a similar level as some other aspects of the pandemic. But I would guess that if there would be a body higher up in the government that would, from not in the times of pandemic, but in times previous to that would focus on those linkages, on kind of a planning and together the various interventions in the field of mental health, as opposed to fragmented planning and then implementation of those programs, then that would definitely facilitate the response as well. But that is something that is I think quite hard to achieve. There are massive, and quite traditional systems such as education, social protection, healthcare, that have their own traditions, their ways of doing things, and in some countries that can be quite hard to move, and yeah, and get to the common ground. But I see that as the best way forward, honestly.
Right. Is it also partially due perhaps because mental health was not such a priority at first, or is it was it seen as a priority, but then the system itself was just unable to facilitate an accurate response in that way, or is there another way to sort of, that's my actual question, I think, like to help more foreground mental health within the sort of the bigger public health domain?
I would say, I mean, I wouldn't say it wasn't seen as a priority. We did establish a special task force and everything, but it was. But on the other hand, we didn't really receive much support. And saying that it's a big priority is more of a lip service. When we compare the, I don't know, how much support we have received across different sectors or bodies. From my experience, the biggest changes happened when the most loudest bells started to ring, and that's psychiatric hospitalizations, and I don't know, we had a problem with getting enough hospital beds for adolescents, and that was like a thing that sprung a lot of people to action immediately, while they didn't really do much for the past year, when we constantly warned them that we need to address this systematically. We need to put a lot of focus effort into it. It's not something that you can just shrug off with a couple of helplines and promotional materials. But yeah, unfortunately, not really successful. So it's. But I also believe that that maybe people realize how huge this thing could possibly be, right? If we're talking about working across sectors, across silos, then mental health becomes a really major topic issue in the whole system. Out of policies are related to mental health, and if you constantly take it into account, that's quite demanding for the whole machine.
Right. Yeah. Well, thank you so much for sharing those experiences. It's really, really interesting. I think for the sake of time, we should just move on to our next panelist, and we can partially come back to this also during our more general discussion. So let me then introduce our next panelist, who is Suranjit Singh, who is a lived experiences consultant and Wellcome Trust, and also the founder and director of Taraki, a non-for-profit organization working with Punjabi communities to reshape approaches to mental health. Yes, I would like to give the floor to you now for some first remarks.
Awesome. Thank you so much, Ariane, and thank you for inviting me to take part in this panel today as well. So my name is Suranjit Singh, and as well as working with the Wellcome Trust as a lived experience consultant and running the organization Taraki, which focuses on mental health in Punjabi communities, I'm also just finishing up my master's in health policy at the University of Toronto. And just a quick sentence before we get into the questions, but my interest and my passion within the mental health space comes from, I didn't study kind of mental health, psychology, health sciences. I came through social sciences and history, but it was after my lived experiences of mental health challenges whilst a student that really got me interested in this landscape. And yeah, really excited to chat with you all today and looking forward to the questions.
Great, thanks. Perhaps we can start by you reflecting maybe a little bit on your own lessons learned during the pandemic, and also how certain communities perhaps have been sort of disproportionately affected by lockdown, and also the full impact on mental health.
Sure thing. So at the beginning of the pandemic, there were lots of discussions, especially in the UK, about how COVID-19 had disproportionately impacted racialized communities and Black and minority ethnic communities. And for me, it was really great that this conversation was starting because this is something, it's a lens that's incredibly important within mental health more widely. But when I was thinking about the organization I run, I wasn't seeing a lot of discussion that was informing how I could actually shape our practice. How could we develop our response to our communities in a way that responds to their needs and responds to how they're experiencing the pandemic? And so the way I saw this was, if we're talking about racialized communities as a really big group, we need to remember that there are so many experiences within that. There are people who exist at the intersections of different marginalized identities. And for me, it was really important that we were able to do a bit more research that looked at how Punjabi communities, so Punjabi communities come from the kind of northwest side and northwest side of current India and east side of current Pakistan. And my question was how we can understand what impact the pandemic has had on Punjabi communities and their mental health, because the current data that we were looking at was too broad. It was too broad and it wasn't granular enough to actually inform work. And so what we did was we brought together a group of citizen scientists. We brought together people with lived experiences and mental health challenges to actually start thinking about how we can start answering these questions. And we came up with 3 really broad questions that we wanted answering. What has the impact of the COVID-19 pandemic and lockdown been on the mental health of Punjabi communities? What support have people accessed during this time? And what support do people want to see in the future? And findings that we took from the was 60% of 400 kind of community level of research. We found that 60% of respondents reported a decline in their mental well-being from before lockdown to during lockdown. And we noticed that Punjabi people who also identified as LGBTQ+ were experiencing particular challenges compared to those who didn't identify as Punjabi and LGBTQ+. And so really taking that intersectional approach was incredibly important because it helped us to understand the granularity, the diversity within diversity. And there are a number of findings from this report, and we had the report, we did discussions on it, we did webinars, we made videos, loads of different knowledge products, because I know not everyone's going to read a 50-page report. I know some people it'd be better to watch a short video, to listen to a podcast, and so we created a number of different knowledge products. But importantly, this research has been used to guide our response strategy to the pandemic. We're not looking at things from, really broad policy level. We're not a governmental organization having to deal with society as a whole. We're hyper local. We're focusing on a group of communities who might be experiencing particular challenges that aren't captured in the data more broadly. And so this was a really great way for us to develop community-based research and actually use it to inform our responses. And just a couple of small things that emerged from that. We were able to develop specific programming that identified and targeted the particular challenges people were experiencing. we were able to develop that programming, looking at the existing support people use to bring the two together. And we were able to really enhance our work that focuses on Punjabi LGBTQ+ communities. And so there are a number of ways that the results from this research have been used in grant applications, successful grant applications. They've been used and cited in Parliament in the UK. They've been cited internationally in other ways as well. But it was a really good way for us to understand and try community-based research. When the data that was being put out by the government in the UK was very broad, and I understand why that was broad, but it wasn't necessarily useful for us in a hyper-local context.
Yeah, that's very, very inspiring and truly important. And just a very good strategy as such. I think that's why it's what is sort of capturing me is also how did you go about going from this community-based approach then to making sure that all of this was heard within Parliament, like that was sort of disseminated in such a way that it was actually informing the right people, in a sense, as you were saying, like before everything was much sort of larger scale and was sort of like everyone together, and that was sort of what the government first was focusing on, which could have a bigger impact in a sense, because it's just talking about a much larger population. It's making the at least the problem look much larger in a sense. So how do you then make sure that especially these sort of hyper or like very focused community-based research projects get up to that same level of attention for policymaking and politicians?
And this is where a lot of privilege comes into the discussion, because over summer, whilst I was doing this research, whilst I was working with our teams, I was doing my university work. And so I was able to have a lot of control over my time. I was able to invest time into thinking about this community-based research. I was able to invest time in, even just sending all of the emails to bring people together, facilitating the discussions to bring people together. I spent time writing up and then also formatting the report. I've spent time thinking about a social media strategy. And so we were very lucky because I had time to think about these things. So the first one was we had time. We were very lucky to have time to think about this in depth. The second one is that we were very lucky to have access to different types of resources in terms of knowledge. So I could because of being in a university, it was easy for me to access academics who could give their thoughts on the project. It was easy for me to access other people with expertise who could contribute to the project. And it was easier for me to think about different ways of communicating our research, because everyone might go to a report straight away. And I think a report has its place and it's important in some cases, but not everyone's going to read it. And so we wanted to really focus on making different types of digestible format of information. So we had poster presentations, we had 60-second videos, we did consultations, we did webinars, and just using different types of social media channels. We had infographics that were put on social media, on Twitter, on Instagram. We had different types of ways of communicating the research, because we know that if I just throw a report to someone, not everyone is going to look at it in the same way. But one of the main things that we were able to do this was because of the control that I was able to have over my time, and also the access that I had to resources. So it was a balance of being in a privileged position where you can have access to these types of knowledge, and also being able to transfer that into the community work that we do.
Great, thank you so much. It would be great to come back to this a little bit more also during the overall discussion, but for the sake of time, I think we should move on to our next panelist. So our next panelist is Manjiru Karanja, if I'm saying that correctly. who is pursuing a master's degree currently in global mental health at King's College London and at the London School of Hygiene and Tropical Medicine. She's also founder of Clear Minds, Better Lives, an organization determined to raise awareness of mental health in the African immigrant community in the United States and globally, while working also with other communities. Yes, I would like to give the floor now to you to make some first remarks.
Yeah, thank you, Ariane, for that introduction. Yeah, my name is Manjura Karanja, and I'm a student at King's, and I'm studying global mental health. First, I want to thank the UEFA for giving us this opportunity to be able to talk about what we care about, which is mental health. And I want to recognize what Shiranjit and Wajid said before I speak to what I have to say. I think that was a learning curve for me as well, to find out about their communities and the work that they do. I think that is really poignant and important as we continue to have and push this conversation on mental health. I will be speaking more so on like the pre-COVID, post-COVID perspective that I saw within my community. I want to say I do have a lot of multifaceted identities on me. I was born in Kenya, I was raised in the United States, and I happened to go to school in London. So those are three sort of like places I identify myself with, but I'm still very a Kenyan girl at heart, and I am a Kikuyu. I was born on the Kikuyu tribe, so I have a lot of identities, and I still identify myself as American. And so pre-COVID, I think there's been a conscious crisis. I want to point out what Mataj said about everyone knows that there's mental health. And there's either like a perception of, you know, I have mental health, I'm going to take care of it the way I want to do it, or I'm going to go through like the academia way of doing it, or going to the hospital. So there are different ways that everybody sees mental health, although they're aware of it. Now, post-COVID, I would call it like a conscious crisis, because with COVID kind of let everyone know that, hey, you have mental wellness. Each and every one of us here was locked out for some days or even months in their own home. And that affects you, whether you like it or not, in an emotional state, because we're also used to being outside. So with that, it was really, really difficult for me to see, especially coming from a Black community and an immigrant community here in the United States. There was a constant mode of like survival. You know, there wasn't time for people to really think of like, oh, like we need to take care of ourselves. Everyone was thinking of how do we survive ourselves out of this? And, you know, kind of pushing back to how mental health is viewed within my community, there's a lot of stigma. You know, this is viewed more rather like a white problem, and quote unquote a white problem, because a lot of people, and I'm sure I'll be talking about that later, is the cultural aspect of it. There's a constant flow of culture and religion that drives how we Black people and other communities view mental health. It's, you know, it's more so like, it's not something we talk about. And so with that happening, I do have to bring up George Floyd. Everyone knows about the murder of George Floyd. I as a Black woman, and having Black parents, having a sister and even brothers, it was really difficult for me to go through COVID, knowing that the plight of Blackness was still being highlighted and other communities of color were still being marginalized, you know, such as like Asian hate crimes and the APPI community. That's been really, really difficult to see on the wave of COVID-19. And I wasn't able to do anything with my foundation at the time. We did a bit of podcast just to let people know what mental health is. I mean, with Clear Minds, Better Lives, I'm still at the beginning, laying the foundation of like, what is important and why do we need to focus and take care of our emotional wellness? So I think COVID brought out two things. Is that one, we all have mental health and we need to understand what mental health is. And secondly, there was pushback for reality to come out and kind of just show the world that, hey, we're all human and our humanity is much more important, as opposed to like the skin color, how we look, where we're from. That doesn't matter, because when I listen to the past two speakers, I really don't want to bomb your names. I hope I'm not bombing your names, Mataj and Shiranjit. I feel as much as their concerns, I feel them, because I grew up knowing that it didn't matter. We were all human beings going through the same thing. So when I look at that from a lived experience, person who's gone through depression, anxiety, and survived suicide multiple times, I feel very honored still that we have this space to keep talking about this, because a lot of people do not understand. And so when you ask me that, what entryways do I see, or what are the solutions I see within the global aspect of it, and even in communities of color and Black communities, I firmly believe we still need to do better in mental health literacy, which is mental health education. And it's great that we have researchers and academia doing what they can to try and bring interventions. But I also think there needs to be a curve way of explaining what mental health is to people. And I was fortunate enough to read a book called Unwinding Your Brain. I do not want to say the title because it's not, it has a curse word in it. So it's by Dr. Harper, and she explains to you what depression and anxiety is through science. And I think that needs to be an open way that science gives, of where we just don't have these campaigns coming out, hey, we have mental health, it's your emotional well-being. For my community, I would say people are better understanding, like, why does it affect me? Because everyone on here understands cancer. Like, when you have to go to the doctor, what steps you need to take, because there's a believable part. It's showing you that it affects you. So it's the same thing with mental health. We need to be able to do better on how we educate ourselves and each other, and even seeing each other as humans and not different from each other, because that also is something that COVID brought out. And so that's all I'll say for now.
Thank you. Yeah, you touch on you have been touching on quite a lot of things that are very interesting and very important. I just wanted to ask you more about what you actually started off with, of like how how mental health in itself had sort of quite a lot of stigma within Black and brown communities in general, and how it was seen as a white problem. How did that sort of impact, you think, sort of access to services in general, or people accessing or trying to access things at all, in a way, and how that sort of perhaps got exaggerated during the pandemic, and how that intersects with experiences of racism, perhaps, not only racism perhaps being the driver of certain the development of certain mental health problems, but also being such a barrier to accessing services, as sort of perhaps there is also experiences of racism within the sort of the mental health system.
Yeah,
can you reflect on this a little? Okay,
right, that's a really good question. So when we talk about why communities of color hesitate towards these services, it's because of lack of representation. That would be the ideal answer I can give you, because most of the time this is a dominated field by most white people and mostly white men. So most Black people are like, I am not really gauging why I need this, because this is not a problem that affects me in my community. Granted, there are a lot of professionals, therapists, psychotherapists, psychologists who are Black that I know are Black, but still it's a hesitancy, because from that aspect, I'm seeing that this was still something taught in school. It's academia. So it's very also going to be hesitant for me to be like, okay, I still trust what someone in my community is saying. And I think that's why there needs to be a lot of more people in my community who come out and speak from a lived experience aspect of where they talk about their experiences and what they've gone through, because the academia part of it is still seen very much as a institution of whiteness. And now you look at racism is the same exact way. Racial systems exist within the system, be it in Europe, be it in the United States, whatever you are, there are racial systems that are against you. So with COVID, communities of color are already seeing that they don't have access to the vaccine as much as other, suburban white neighborhoods do. There's lack of, Africa says, they're not going to be able to vaccinate it until 2024. And here in America, almost the population has gotten vaccinated. So I think it's also the system of government, the system of healthcare. Healthcare does not see Black people as important or as vital enough. When you look at the statistics of Black women, and they die more when they're giving birth as opposed to other races. And so there's so much to be looked at in terms of healthcare. And so that is where the hesitancy comes too. And that's where the stigma is too. It's like, we're also not going to be taken care of. So there's also lack of trust within the community. There's lack of, there feels like there's lack of empathy. And even when you look at the healthcare system itself, it's really flawed in the sense of like, our basic human right is healthcare. All governments, all corporations, they need us to be alive, or they need us to be well, to be able to do whatever it is, be it work for them, be it represent them. So it becomes really difficult when we have to argue about healthcare, because I myself believe that healthcare is a basic human right. We should not have to pay for healthcare. And people like us who are trying to represent, mental health, wellness in our communities, we shouldn't have to struggle this much to get actual professionals or academics or researchers to be able to come to the table and get together and give mental health services to communities that are marginalized. And unfortunately, the system has it the other way around, where it's harder. When you hear my TED talk about how it was hard to get just hospital beds for kids in his community, like, this is health we're talking about. And the reason why I'm passionate about this is because I have been through it. So, and everyone in my community was like, you're crazy. Like, it was very much, I was set aside. I was not part of community, which is really dangerous. And that's what happens to people. And I'm very empathetic to the fact that that is not the case. And it's not just about governments and corporations also working. It's also about us as a community. Like, I as Wanjiro cannot be the only one representing Black people all the time. There needs to be some sort of empowerment. And I would not know how we create that trust as well, from a standpoint of, I'm doing the work, I know I'm doing it, but still I really see people being very hesitant. So representation is big, like being able to see people like me in those spaces is really, really important, but as well as changing the system. And that's gonna take work. It's gonna take a lot of work.
Right, yeah. Since it's so ingrained into everything. Well, thank you for sharing that. Just also for time, I think we should move on to our next panelist, and I would like to give the floor back to Frida.
Thank you. I would like to welcome Pushali Ganguly to our panel. She is a PhD student and a research associate in health economics at King's Health Economics. And she completed her master's degree in global mental health in the London School of Hygiene and Tropical Medicine and King's College London. And she completed 2 interdisciplinary programs. One is called PLUS, International Interdisciplinary Researchers Program, and also the Royster Global Program. So we will ask her some question about interdisciplinary research methods today. Welcome, Pushali. I will give you the opportunity to say some opening remarks.
Thanks, Frida. Also, thanks for inviting me to be on this panel. I feel like all of the discussion so far has already sparked so many good thoughts. So thank you also to the other panelists. About the pandemic, I guess, I feel like every time the world faces a major epidemic outbreak, we're reminded of how ill-prepared we are to deal with it. And this is despite the fact knowing that it's going to happen again. So I worked as a data analyst at the WHO on the Ebola epidemic in 2014. And our response then was very fragmented. There were lots of limitations that came under close scrutiny, like the governments, the health systems, researchers, epidemiological teams. And I feel like there were calls then for this ongoing coordinated system, more sustainable financing. And now if I think about the current pandemic, it's the same thing really. So I feel like what have we learned? And if I think about this, if the COVID-19 pandemic has taught us one thing, I feel like it's that health and maybe the economy are very deeply intertwined. So it's this connection, this balance of different things, and how important mental health has been to all of that. And this has been said by many of the other panelists. It's having the privilege of time to act on these, the very demanding action required for the whole machine. I think Matej put it as the health system, the government, and it's a huge task. And I think interdisciplinary learning is really important to that. And early career research, or clinical practice, if that's what you're doing, I feel like that's really the space in which to do it.
Thank you so much. You've mentioned the current pandemic, but also Ebola, I think, yeah, as another health crisis. And in some of your work, you mentioned those syndemics as something we will deal with in the future. Maybe you can explain a bit what those syndemics are and how they should be tackled in the future.
So a syndemic, I think, is described as a synergistic epidemic. So it's when, disease states interact detrimentally and leaving communities more vulnerable. They get exacerbated by inequality, and they demonstrate how this interplay between the social, economic, and environmental, even political conditions can influence health and mental health specifically. There are so many frameworks and theories out there that talk about this, but in my experience, it's not something that we cover or that we think about often. So if you think about medical practice or medical research, some specialties, we continue to work in these very segregated ways, and the segregation happens because of funding and training schemes and opportunities, the departmental structures that we might work in. In the UK, I want to say interdisciplinarity is being looked to more as a solution. We're allowed more flexibility to have intercalating years. We're allowed more opportunity. I guess I'm an example, having been part of 2 different programs over 2 years, that this is something that is valued. I think good examples are maybe looking at HIV. So it has happened where it has been recognized that actually mental health is a huge part. It's not just enough to have the antiretroviral therapy. If people are unable to access it or take it for various reasons, if there's food scarcity, if there are problems with living situations and conditions. So what this idea of syndemics is saying is actually we need to think of more broader aspects, these social determinants. And early career researchers, again, are in a very good space to think about these.
Yeah, very important issues you were touching upon. I would be interested in learning a bit more about how we could actually scale up the interdisciplinary work, research, especially like we as young or next generation researchers and practitioners. What are ways we could increase the interdisciplinary work?
So I think one aspect is just making sure that there are the right funding schemes and the time given to early career researchers to pursue some of these thoughts. The second is actively, governing that collaboration, providing the space and the network for people to make links. So through these programs, I worked with, I think, researchers from 6 different countries around the globe in all types of disciplines. So, I worked with people studying human geography and climate change, piracy in the Gulf of Guinea, piracy, not the video CD type, the Pirates of the Caribbean type. And it was really important, how do these very common experiences in different parts of the world, how do they affect people in those communities? So there's a people-centric response to health and to mental health. There was this idea, I think I got together with this group because we had a week to work collaboratively together in person, and it was all paid for. People got to come from all the different countries. And I was walking around, and there was a note, like on one of the notice boards for one of the groups, they had the graph of GDP, where the GDP just grows exponentially. And I was walking around, and I work in economics, and I walked up to this group and I said, actually, that's very flawed, and that's not something to aspire to. And that's kind of what sparked our collaboration. And I introduced to them this idea of donut economics. I would recommend it to everyone working in health and beyond. It talks about how systems, while at the same time looking at the basic needs, need to think about the planetary constraints. So, we do need to think about the climate, the environment, how much food we can have at the same time as managing basic needs. And I was able to learn how human geographers can help me thinking about health research within this framework of donut economics. So that's just an example, a small example from my own experience of how this can work.
Thank you so much. Yeah, maybe as a last question, because I'm a practitioner myself, and I'm always interested in how can we translate the research into the healthcare, like into the practice, like what could be strategies to translate like interdisciplinary research approaches to the practice?
This is an interesting one because I'm not a practitioner, but I work with others. I want to say, necessity breeds innovation. And from what I've seen with colleagues, people have, for example, have really adapted to being able to deliver therapies online. And this is something people have asked to be able to do well for a really, really long time, but it has somehow evaded us. Come the pandemic, and suddenly the changes happened very quickly. The research has managed to get to the practice end very quickly. So I think there are opportunities that come with this pandemic, and hopefully there are more that, where the sharing can happen.
Thank you so much for now. I'm sure we will revisit some of the issues you've raised in our general discussion later. I would like to introduce now Gargana Manulova. Hello and welcome to the panel. She is a clinical psychologist and a global mental health researcher. She's also founder of Globally Minded, a foundation aiming to improve knowledge and research evidence on mental health in Bulgaria and globally. And she has also set up a website, globallyminded.org, and she's creating newsletters to help coordinating the global mental health community. Welcome. I will give you the opportunity to give your opening statement. Thank you.
Thank you, Frida. And thank you very much for the invitation to be on this panel with all the other bright people that I can learn from. I'm a clinical psychologist, and I started out as a psychologist in my career before taking a more global perspective. And in doing so, I noticed that there is actually very little out there about mental health outside of the mental health community. So the topics that I'm most passionate about right now are the so-called psychoeducation, or we could also call it mental health literacy, amongst people who are not in the mental health field. and also how we perceive what we perceive mental health and mental illness to be, and how we move on, not just after the pandemic, but because the situation was bad enough even before the pandemic. We had a huge mental health, mental illness burden unmet in every country. And what the reconfigurations to our health systems and our society will need to be to meet this hugely increased burden post-pandemic. So I stand ready for your questions.
Thanks so much. Yeah, yeah. I mean, we have talked so far quite much about weaknesses the pandemic has kind of revealed about our mental health systems and health systems in general. What do you think? What do we urgently need to improve our current mental health system? What would be strategies you would suggest?
Many of the speakers so far emphasized how mental health was sort of sidelined in the pandemic itself. And Matej started it off by saying how the greater part of society and institutions only got to move on with things when there was a real mental health emergency that was very physical, very political, if you will, the lack of beds for adolescents or the acute hospitalizations. And for the rest of it, it seems that mental health was just sidelined, ignored, although it was very clear when you impose lockdowns on people that mental health is really going to suffer, because you're cutting them off from each other and you're cutting them from their community. And secondly, there are things like that human beings are creatures of routine, and here is this routine disrupted on a grand scale across the globe. Maybe only now we're starting to realize, maybe mostly mirrored in children and adolescents, how much this has cost in terms of mental health and mental illness. We should also take stock of how we could help not only this younger generation, which, as we know, a lot of mental health conditions arise in these early years up to the age of say 20, but also to help our own mental health across the lifespan. And I think for me, the key is, again, in psychoeducation and literacy, and raising the literacy of people who work in institutions, people who work in healthcare and education. For me, those are the most urgent points: education and healthcare. But then we could continue to, unroll better mental health awareness and knowledge and care across the workspace, across communities, in institutions and the whole social network, where people interact with each other, to meet their needs or to get help or to build a better society. And mental health needs to be this kind of horizontal policy that cuts across sectors and silos. Because as Wanjiru said, we all have mental wellness, and it's not just privilege for certain people. You have to take into account your community, but also you have to take into account everybody else that falls under the policies you're making.
Yeah, speaking about policies, during the pandemic, there was an increased call for pan-European responses, crisis responses. And I mean, as health is still nationally coordinated, in Germany, even regionally. So like, what could be strategies, or maybe how can we move forward, learning from each other, like from each other's policies, crisis responses, especially, of course, in terms of mental health. And yeah.
I think a big thing is what Shiranjit mentioned in terms of lightning quick research on a hyperlocal level. And I mean lightning quick because research generally happens on a quite slow scale and turnover over the course of decades rather than, you know, over the course of a year, even a few months. And Pushali also made this point, and I think when she was talking about the Ebola crisis and the fragmented response, and this was another case, I think, where healthcare situation was scrambling to, you know, do the necessary research, not just in terms of what is this illness we're facing, but also how is society reacting to it. I know that there was very good research that came out of the Ebola epidemic of 2014 of how we can use very quick research done by people like medical anthropologists or behavioral scientists in terms of how people react to the pandemic, how they react to the news of it, how they react to the restrictions imposed on them, what the dynamic, just their everyday behavior and mood is. And I think this is also the kind of thing that we need to plan into our future responses for hopefully not another pandemic. Let's all keep our fingers crossed, although this is too optimistic according to, you know, epidemiologists. But definitely in terms of crisis response, we need to be able to conduct this, just to be able to very quickly gather up the people who generate the knowledge. And those are the professionals, those are the clinicians, those are not the researchers. The researchers know how to do research, and they could do a lot in teaching the professionals how to do it in their own setting. But it's the professionals that need to generate the knowledge that will go into being shared with everybody else. And we need to organize these platforms and this pan-European or international country-to-country cooperation, where professional networks just share together their findings on a day-to-day basis. We saw that with the COVID pandemic, how, you know, medical professionals were sharing very quickly what they saw, and this is what helped plan our response. But we also need to do this for social work and, importantly, for mental health.
Thank you so much. For the sake of time, I will move quickly to our next panelist, but we will have time later to revisit some of the issues you've raised. Thank you very much. I would like to introduce now Jessica Love to the panel. Welcome. She's pursuing a master's in medical anthropology and sociology at the University of Amsterdam. And for a thesis project, she is working on a project together with Dutch Red Cross, researching the aspects of climate change that influence mental health in the Netherlands. Welcome, Jessica, and the floor is yours for a short opening statement.
Thank you, and thank you for the invitation to join the discussion. It's been really interesting so far. As you mentioned, I'm interested in the relationship between climate change and mental health. So my project now is specifically looking at how heat waves influence mental health in Amsterdam, so in an urban population. And regarding the overall theme, I think the future of public mental health should definitely consider the climate crisis as one of the most urgent issues. I think it's really important, and not just with the immediate risks like how heat waves influence mental health or other climate change related disasters, but also how things might change in the future regarding adaptation and mitigation strategies as well.
Thank you. Yeah, I wanted to ask you, I mean, the field of mental health within this planetary health sector is, it seems to me, relatively new. I mean, now we are also with the media attention at the moment, I think this is an issue that is more seen. There are also like groups forming, like Psychologists for Future, those kind of subgroups of the climate movement. But from your perspective, do you see, or do you feel that public mental health is underrepresented in this kind of planetary health research agenda? And how are the trends there at the moment?
Yeah, I do. I think at the moment it is underrepresented. I noticed when I started my research that I really had to dig to find studies that were specifically looking at climate change and mental health. But last month there was a scoping review published. I can always share that in the chat if anybody's interested. And they looked at climate change and mental health studies from 2001 to 2020. And what they found was they didn't find anything until 2007. And then from 2007 to 2020, they found 120 original studies that were specifically mentioned climate change and mental health. And of those years, the highest number of studies was done in 2020. So I think, yes, it's underrepresented, but it's definitely trending in another direction. I think it's becoming more popular, and people are definitely starting to realize that it is an urgent issue that needs to be researched.
Yeah, glad to hear that that it's scaling up at the moment. What do you think, because we're looking at the future of public mental health, what are the issues we have to look at in the future regarding this relationship between mental health and climate change?
Yeah, I think the majority of the studies right now are looking at the more direct impacts of climate change on mental health. So storms, heat waves, droughts, flooding, things like that, which have a variety of impacts. But I think in the future, we need to look more at the adaptation and mitigation strategies, as I mentioned before, but also really focus on climate justice, because as we all know, the high-income countries are more responsible for creating the problem of the climate crisis, but the low and middle income countries are suffering the consequences, and they have less resources to adapt to, the various issues that will come up. So, and also the studies that I mentioned before, those 120 studies on climate change and mental health, 87 of those were done in high-income countries. So there's definitely a need to research in low and middle-income countries. And within those countries, I mean, this is just very broad, obviously, but I also think there's a need to focus on urban environments. The United Nations estimates that 2/3 of the population of low and middle-income countries will live in urban locations by 2050. So I think in an urban environment, those climate change related disasters will be more devastating, obviously, because the population is more densely packed. And there's other things to that too. The urban environment, you have less access to green and blue spaces, which is also a problem with mental health. And for heat waves, there's the urban heat island effect, which makes the urban areas even hotter. So I think the effect on the urban areas will be more pronounced.
And what do you think, what could be ways of increasing awareness of these important issues you just touched upon? Because as you said, there's some sense of urgency, yeah? So it's quite time sensitive. And so what are ways that we can kind of set a spotlight on these issues?
Yeah, I don't work in public mental health, so that might be a question better for someone else on the panel. But I think defining the problem is important, since it's such a young area of research. I think we first need to figure out, for example, what will the problems be with climate change adaptation and mitigation, and also changing the conversation to understand that the climate crisis is not a future problem. It is a problem for today. It's something that we need to address now. But someone else might have a better answer to that.
This could be a perfect transition to our open discussion, which will have a bit of time now, and I will give the moderating role to Arjen.
Great. Yeah, let's open up the discussion a little bit, and so I'll be sort of to pose some more general questions to the entire panel, so we can have a bit more of an overarching discussion. But before we go into that, I also want to ask all the other attendees that there's the possibility now to ask questions to the panel and post them in the Q&A section here somewhere below, that we'll then attend to a little later. So, but now for the overall discussion, let's take roughly about like 10 minutes or so to go back a little bit to our more of our central questions on sort of what are the bigger paradigm changes that are sort of urgently needed to reshape our mental health systems, and how we can sort of shape a different sort of future of mental health, and what the role specifically of for like next generation researchers and practitioners can be, and how we can sort of be facilitators of such change. So yeah, if we can sort of take roughly like 10 minutes to reflect on that together a little bit, but also there would now be a possibility to sort of respond to each other's remarks from the previous Q&A, but perhaps we can stay a little concise so that we will have enough time also for the questions from the audience later. So who wants to start?
I'm happy to jump in first. So as I mentioned, a lot of the work that I do at the moment is concerning the role of people with lived experiences in the context of mental health research and mental health practice. And it's important to acknowledge that people who have had experiences of mental health challenges have often been excluded from mental health research, decision-making, funding decisions, grant awarding, evaluation, writing, and generally the mental health landscape more widely. And it's only over the last few decades of really, really diligent survivor activism here in the UK that this tide is beginning to turn. And when we're thinking about the involvement of people with lived experiences and mental health challenges, oftentimes we just think about the development of services, the dissemination of research. The amount of times I've been emailed by people who have done research and they've said, "Can you help us disseminate this?" At first, I used to be like, "Oh, this is great. It's getting us to kind of disseminate this research into different audiences." But then I realized that why don't we have a seat at the table when the research is being done? Why don't we have a seat at the table when the research is actually being ideated and theorized in the first place? And so there are lots of questions about where in that process people with lived experiences and mental health challenges can get involved. And my response to that is anywhere in that process. It's a question of imagination. It's a question of the resources that we have. It's a question of how much we want to learn and how much we want to engage with the people around us. And so when I'm thinking about a future in the mental health landscape, in public mental health, it's a future that engages people who have the experiences of the communities we're working with, of the particular challenges that we're focusing on, people who have expertise that goes beyond our academic work, that go beyond our professional experiences. But we have expertise that come from a wide range of areas, so that we're not thinking right at the end, why is the dissemination not working? Why is no one reading my paper? Why is no one engaging with our outreach? Why are no participants coming and getting involved? Because we're thinking about these questions from the beginning, because the people who we're working with are people who are standing alongside us from the start, rather than people we're just sending emails to when we want consent forms to be checked over. And so for me, that's one of the core things I want to see in the future of public mental health, because as was mentioned earlier, when we're thinking about interdisciplinary work, it's also engaging these emerging disciplines like lived experience practitioners, lived experience consultants, who are bringing different kinds of knowledge. And again, these are folks who need to be a part of the landscape as equals, as collaborators, and as colleagues.
Could I add on to what he just said? I think that is so important, because I never thought of it in that way, where we ask people who have gone through it and need to have a seat at the table. But I also think that it runs into how research is done, whereby we're so different and we're so multifaceted and we're multicultural and diverse. And the reason I bring that up is I mentioned representation earlier. So Shirajing had said that, within diversity, there's diversity. And, from a population of India and Pakistan, I can only imagine the kind of population that is there. But just to kind of like put it in perspective, all of us here we're first of all human beings, we're the human race. And then we go into our multi-faceted backgrounds, Europeans, United Americans, Africans, whatever. And then you go down and you're like, oh, I'm Kenyan, and then Frida is German, Shardine is Indian, Gagana is from Bulgaria, there's that. But then you lower it a little bit, then there's the actual individual, like where my family is from, but my family is from another tree. So there's like so much to dissect. And I think from that standpoint of representation and having people with lived experiences, because truth be told is my experiences are not going to be the same as another Kenyan woman. They're not going to be the same as another Black American woman. They're going to be so different. And what I'm finding really difficult, even now as I'm in my master's, is that we talk about all these case studies and we do all this, all this types of intervention plays, and we're doing all this kind of like, how can we make it better? So we're doing scale ups. But my core issue with that is that we still look at things in such a generalized context and such a broad view. And I think with mental health, there's still quite a room to actually like try to define it more, trying to ingrain it more. And the reason I say that is because of, one, that us having a seat at the table, but also like that lived experience. Because if I try to say, okay, I'm going to get a lived experience person from Kenya, yet all the papers that I've seen are only like research papers on sub-Saharan Africa, that is going to not help as well, because whatever someone in Ethiopia has gone through, or Sudan or Somalia, is completely different from what I'm going through. And even to make it more contextual in that, I have not grown up in Kenya, so I do not know anything to what someone may be going through back in my home country. So there needs to be more research in that. And then there needs to be representation. If anyone from here is watching, at least from my background, is I would urge you to empower each other to study these things. Like there's so much shortages of study within communities, especially communities of color, that, you're taught to only be a doctor, a lawyer, a pilot, or whatever. But I think for humanity to survive, we need to encourage young kids, young adults to also ingrain themselves in things like mental health, climate change, things that are affecting us at a rapid stage, because that's what COVID did. And when we talk about climate change too, I've studied a bit on eco-anxiety, and that's exactly what happened to us with COVID. Like our lives stopped, but we started to worry about our survival because our outside was jeopardized. And that's what climate change is going to do, and it all falls down to community responsibility, but also individual responsibility. Like I feel very responsible for how I take care of the planet. I feel very responsible of how I talk about mental health and how I want to take care of others around me mentally. So it also falls down to individual responsibility. And I highly believe that cannot happen if we don't have representation. So, yeah.
I agree. It's very important that we have the researchers and we have the people and the resources to study and pay attention to our communities and to the things going on in them. And then to have the same people go and advocate for their own communities and represent them as people with lived experience. And anyone can just study and learn about mental health. They don't have to be a professional. They don't have to be a researcher. They can just take the time, or they can enroll in a course, hopefully, or they can just, take a module at school to learn about mental health. And that would make them better advocate. That would make them better friend, better family member in terms of helping others with their mental health issues and understanding the place which mental health has in our lives. And this is how I think we should proceed, with just expanding the sphere of people who know about mental health.
I wanted to say it feels like something fundamental that really should change is what we consider valuable as evidence. It feels like, Suranjit's very hyper-local evidence is just as valuable as, the infectious disease modeling coming out of Johns Hopkins. And something I found useful in the past, I was told when you're, I think it happens a lot when you're ideating, is to not say but to say and you'll realize that actually ideas keep generating and you have a clearer focus. So it's not either or, it's actually all of these things can be true, which gives us the more holistic view, which makes mental health more accessible.
Yeah, what I'm hearing is that there are so many opportunities, also more on sometimes on an individual level. Are there also ways more on a more systematic level that we can sort of accelerate such processes, for instance?
Yeah, I can jump in for that maybe. I mean, I see the future because we've been talking about climate change and so on and what's ahead. Not only as necessarily more sustainable, but also more equitable. So for me, what seems like a great way to go is doing more policy impact assessments. So impact of policies on inequalities or on mental health, various mental health outcomes. I think that there's more and more data, from routine data to measures, are eventually going to get more and more standardized, more and more useful. So policy impact assessment is something that I think is quite could bring a lot to the whole discussion and to the arguments as well, that we are trying to make right now, more on a individual or experiential level, but coming up with evidence on impact of policies on health inequalities or so on, or social justice or similar issues, that could be quite useful.
Great, thank you for sharing that. I think it would be good to now give some space to the questions that were raised in the Q&A. I think Frida has been keeping an eye on those, so I'd like to give the floor back to Frida.
Thank you. With perspective to times, with there 5 minutes remaining, I will pick maybe one or two questions. There was a question in which ways we can support the general mental health of the population during a pandemic. besides offering helplines and educational materials? Maybe this could be a question for Matej. Is he?
Yeah, I can try to be really short. So what I had in mind when I said that there's more to it than just doing helplines or educational materials is directly addressing the risk factors or enhancing the protective factors. So to be quite specific, in retirement homes, a lot of people were basically, to put it very plainly, trapped, and the relatives could not even see them. So finding a way to get them close, to get in touch, although not in touch per se, is something that is relevant to, that was relevant, still is relevant for, a majority of population. At least that's the situation here in Slovenia. Also in schools, we all know that the grading system, the grades, the benchmarking is a major source of stress for the school-aged children and adolescents. Getting the message through to the educational system that you might think about dropping the bar a little bit is something that we try to do relatively unsuccessfully. So those are kind of the issues, and you can go even more upstream from there, but that's what I had in mind when I said it.
Can I add something to this?
Of course, yeah.
I think other ways, well, digitalization of health is going to happen. I don't like it. I'm not a digital kind of person. I prefer the face-to-face contact as you do in therapy, but it's still going to happen. It is here. And we see a lot of use being made of mental health apps. Now, the quality is variable and the usefulness of them has not been established conclusively yet, although people have anecdotally found them useful. Another way to support the mental health of the population in a pandemic is to attach a mental health module to the ubiquitous COVID tracing apps that we were invited en masse to download, that our governments created. And adding general advice on mental health, not just health and how to prevent an infectious disease, would be very helpful in terms of, having these mass campaigns. If you think about it, by now we have internalized the message: wear a mask when you're indoors, wash your hands, generally try to keep social distance from other people. And if we had campaign for mental health with the same intensity that we did for COVID, or even, at the same amount spread over 10 years, we would have internalized a lot of very useful messages by now as a population. So this is also the way, just make sure that there are campaigns utilizing various communication channels and make use of innovations as well.
Thank you so much. I would maybe close this Q&A round now. I think we've just covered one question, but in depth. So, but then we'll have a few minutes left for closing remarks by Arjen.
Yes, great. Well, first of all, thank you all very much for sharing all of the incredible, valuable thoughts here. I think we learned a lot today about, first of all, community-based approaches, intersectional approaches, looking both at sort of what we can do on individual levels and more system levels, while trying to sort of integrate so many of those approaches and sort of on the sort of interdisciplinary sort of intersection of things when it also comes to climate and economic impacts of first of all a crisis, but also looking into the future and how to move forward and hopefully preventing a lot of harm that may perhaps come our way in the future. But thank you so much for sharing all these thoughts on how we can sort of shape the future of public health and how that also should look different than how things are being approached today. But so with that, I would like to close today's sessions. I would like to thank Viola Graaf and Deborah Miranda for their technical support. But above all, I would like to thank the co-moderator Frida for all her efforts in organizing all of this, and first initiating this and working so tirelessly in making all of this a reality and putting it together. Thank you so much. Well, then I would also like to thank you for organizing this European Public Health Week and for picking such important themes for the 5 different days that this is sort of spanning on. And so I would like to encourage everyone, the attendees, but also our panelists, to check out other events that are happening this week and joining other discussions in all the other different days. And as was mentioned before, this session was recorded and will also be available on YouTube later on, so people can go back there and watch it again if they would like. But with that, I would like to thank all our panelists today, and I think we're at the end now.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
All right. Goodbye, everyone.